What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering why it's nice having different ethnicities in your department, especially ours is Xray Tech. I am an Xray Tech, been doing it for 4 years, 7 on, 7 off. I would say it helps a lot. Because I know some people like, oh, Miguel, racism, da 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 da. No. Some patients, and you'll learn in your books, do natural with their own ethnicity. Like it could be a language thing, it could just be a comfort thing. I'm not sure. But I will see so many times when my other partner I have with me, he's African American, will go into a room filled with my people, the Hispanic, the Mexicans, and we'll be talking English. And they'll look at her like, what? And then they all straight look to me like, can you help me, bro? And then, I go in there and talk them, and I talk to them. And I can, gauge based off of how they look and how they talk if I'm, having to talk to my parents, which are first generation Hispanic Mexicans, or if I'm talking to someone my generation, the second generation. So, I can tell and gauge, because sometimes the other techs will try to talk to them and explain stuff, and they'll be like, what? And then I come in and explain them in a way that I would probably explain something to my parents. And they're like, oh, okay, yeah, it makes sense, whatever. And even with her, when there's other people of her race, when she's African American, and I've seen it before where I'll go and try to do something and they'll be hesitant. But then the other tech comes in, who's African American, and then they're all happy and joyful, and then just there's different vibe, there's a different thing where it just the click, and they're just trying to help you out. It's a sister trying to help you out. Like you can tell how you're more comfortable with if you see someone of your own race, of your own color, or just speak your own language. Like you see it all the time. It's just something that it just makes the job easier. It's not necessarily always possible, but it just simply makes the job. Trust me, there's been times where there's been some Americans, some light-skinned people, white people who come in, and typically more older, and they'll be racist. And it's me and my partner who are both not white. And they say some words that are most not nice. And we're just like, bro, we're just trying to help you. And they'll be like, can I get a white tech? And they're like, there's no white tech. I'm sorry. It's just us. I'm sorry. There's no one who can help you. I'm like, we can get your nurse, but if you want this, it's going to be me or homegirl. Ain't no one else here overnight. And we're not going to call someone in. It happens surprisingly how you deal with racism, even in the hospital. Even in this era, I've been called all kind of slurs. My partner, who's an African American, has been called all kind of slurs. We've both been disrespected at the same time. It astounds me. And the sad part is we're trying to help the patient. We're not even being mean. Most of the time, we try to keep a level of professionalism. Even if we're being disrespected like this, just simply knowing they're regular people. They don't work in the medical field. This is your job, your career. Be professionalism. Avoid conflicts. And just do your job. Sometimes they'll be saying those slurs and you're just like, okay. But you just try to do your job. And you're just like, it's whatever. I'm probably never going to see you again. Kind of stuff. You just take it to the chin. Kind of do stuff like that. Because there's been times where other medical workers let it get to them. And they kind of snap off. And then later on have to deal with consequences. I'm too chill back and slide back. I'm like, it's whatever. I'm not gonna fire or do anything like that. As long as they're letting me do their job, they can say what they do. It's fine, whatever. Let me just I'm just trying to help you. Yeah, it's been Miguel. See you on the next one.